Hello, everyone, and thank you for coming today. I'm Marty Donovan, and I'll be the speaker today. A little bit of housekeeping before we get started. The class is a little smaller than usual, probably due to the holiday weekend, so this would be a good opportunity for you guys to ask more questions, and I've tried to get all those. If you have any questions during the talk, you can write them down in the chat, and I'll answer them at the end with the help of my moderator. If you'd like a copy of the slides, the link is in the reminder emails for the talk from Eventbrite. There's also a link in chat. So let's get into this. So today's topic is improve and protect your joints through lifestyle. As you can see, I'm a pharmacist, clinical nutritionist, and herbalist. My journey started as a pharmacist, and over time, I saw a lot of deficiencies in that kind of one-sided focus, and I expanded out into natural medicine, going on to become a nutritionist and then an herbalist. So my focus now, I've retired from pharmacy and I just do natural medicine. And this is an example of what I do. So in terms of what we're going to be talking about today, we'll talk about joints. What are joints? Where two or more bones meet and allow movement. So we're able to move around. Joints are part of that whole process. So the purpose is to allow movement. And then depending on the joint, there's more or less movement. Some joints can bend, some can rotate. Actually, some are actually fixed, like in your skull. So let's take a look at the anatomy of a healthy joint. So joints consist of the following. And you can see the image on the side, and then the details: cartilage. This lines your joints to absorb shock and reduce friction. And this is one of the main features in some of the health problems come up, like in osteoarthritis, is complication with that cartilage layer. The synovial membrane and fluid provides lubrication and clears debris out of that area. The ligaments and tendons provide support. Basically, we're a pile of bones, and this is what keeps us upright and in motion. The bursa, this is a fluid-filled sac that provides cushioning. So these are a dynamic living system and need to be tended to, and they can be damaged. One example, very common, is osteoarthritis, which is the most common form of arthritis. And using the term arthritis can be many different conditions, but generally when people say arthritis, they mean osteoarthritis. And this would be a direct degeneration in the joint. They also call that wear and tear arthritis. So the cartilage, unfortunately, is breaking down faster than it can be replaced, and the underlying bones rub together. And that's where the symptoms of arthritis come from. The pain, the inflammation, the lack of range of motion is from this contact that's going to happen. It can also round the edges of the bone and cause deformation of the bone itself. So this occurs most frequently in commonly used joints, which are hands, hips, and knees. And again, this is the source of most common joint pain. Rheumatoid arthritis is a completely different type of arthritis. Again, less common than osteoarthritis. This is actually an autoimmune disease, and it's actually not a problem with the cartilage. This is where your immune system is attacking your body's systems. So this is not a wear and tear arthritis. It's an inflammatory autoimmune arthritis. Bursitis is an inflammation in the bursa, typically caused by repetitive motion or positions that put pressure on the bursa or around the joint. So repetitive motion can affect a number of different areas. Tendinitis is another one where you're getting inflammation of the tendons, and usually that can be caused by repetitive motion or actually by injury. So one of the things to keep in mind for wellness is trying to avoid repetitive motion conditions. So how can I didn't go to the right slide. Here we go. So what's the incidence of the osteoarthritis? 32 million Americans are affected. I mean, that's a large number. 1 in 4 adults are affected by this. In the 65 and older camp, 43% have this. And in the 45 and older camp, 88%. So you can see it's older age. Again, the degeneration is age onset, wearing away over time. But there are some risk factors involved in the development of osteoarthritis. Being overweight, extra weight puts excessive stress on the joints. You're carrying that much more poundage walking, especially hurting the knees. You're carrying all that body weight around. Genetics, relatives with an osteoarthritis who have osteoarthritis have increased risk if it's in your family. In terms of race, 78% are non-Hispanic white. Joint injury, overuse, so joint damage increases risk. If you've had an accident or something, you're more likely to have complications with that joint. Especially think about high school sports like football, and then later in life, there's a lot of arthritis going on. Age-related, again, it just increases with age. There's a wearing away over time. And then in terms of gender, women are actually more likely to develop osteo than men. So the progression of osteoarthritis, again, wear and tear from injury, obesity, repeatedly lifting heavy objects, things like that. This can take months or years to progress. So again, it could be a employment like a mailman, or it could be a bodybuilder, things like that, or just your normal job that requires you to lift heavy amounts of things, put you more at risk. So there is destruction of the cartilages beginning. Extra stress on weight-bearing joints damages and wears away cartilage, causing a lack of cushioning in the joint. Then the destroyed cartilage, the bone ends begin to rub against each other. Bone spurs can form. The cartilage is thinned out. The damage makes moving more painful. You may hear grating, crunching sounds, and you would have reduced function and disability. Now, in terms of the long-term effects of having osteoarthritis and how does that impact your life, first is pain. Those with osteoarthritis have more pain, fatigue, and disability than their peers do. The severe pain is common. 1/4 rate pain is 1/4 of people will rate their pain as a 7 or greater out of 10. Over 50% of knee osteoarthritis will end up having to have a joint replaced. It can cause depression and isolation. 1/3 of those with osteo have over 45 suffer from depression or anxiety. There's reports of days in the past month of poor mental health. Social isolation and loneliness increases pain, and vice versa. So the pain keeps you from going out, and then the lack of going out leads to loneliness, etc. So it's kind of a downward spiral. Activity limitations, almost 44% of people with osteo have arthritis attributable activity limitations, defined as self-reported limitations in usual activities because of arthritis symptoms. So they're just not doing as much as they know it'll hurt if they do it, so they do less. And then even employment or work limitations. It can affect your quality of your work, your ability to perform. 30% of osteoarthritis sufferers find that stooping, bending, or kneeling can be very difficult. 20% can't walk or struggle to walk 3 blocks or to push or pull large objects. And working age people with osteoarthritis have lower employment rates. Again, that can lead back to the isolation and then the depression. So the big question is, how do you improve and protect your joints? So we'll talk about diet, weight management, exercise and stretching, and lifestyle changes. Starting with diet, the standard American diet, and the acronym of SAD is very appropriate. This is a major source of inflammation. The goal with osteoarthritis is to be on an anti-inflammatory diet, and the typical American diet is pro-inflammatory. Things like high sugar, processed carbs, unhealthy oils, and then, so that's on the consumption side, is that you're eating these things that are pro-inflammation, and on the other side, not eating anti-inflammatory foods. So you could think of eating something pro-inflammatory like sugar as being doubly bad. Not only are you eating something that's not good for you, it is ramping up your inflammation, and it kept you from eating a better food. And same thing with it, anti-inflammatory foods are doubly good for you. They're better for you, and they help with inflammation control, and you didn't consume the inflammatory product. In general, saturated fats, this would be considered to be excessive saturated fats, can increase the progression of joint damage. Too much refined sugar can also increase inflammation and pain. On the other hand, the best diet for preventing and improving joint damage focuses on getting adequate nutrients and decreasing inflammation. The Mediterranean diet is the answer to that. You want to focus on fruits, vegetables, whole grains. Extra virgin olive oil is a great source of fat and one of the main sources in the Mediterranean diet. Virgin olive oil, actually, you can take it like an anti-inflammatory supplement if you want to. It's that good. Adequate protein, you want to get those through lean meats and fatty fish, and then reduce the red meats, sweets, and butter. So those are kind of the differences between those two diets. So how do you go about maybe incorporating Mediterranean diet with a day-to-day decision-making things? So if you're going to have butter, consider using olive oil instead. If you're going to have refined grains, then go for the whole grains: barley, bulgur, farro, couscous, whole wheat. Have nuts and olives as snacks instead of coarse chips or other things. Add a dark green salad to each meal. 3 to more servings of legumes and lentils a week are advisable. 4 to 5 serving of vegetables per day. Try to avoid the sugary desserts and maybe have some fresh fruit or published fruit. Maybe switch beer and liquor over for red wine, and occasionally change red meat to fish and poultry. So those are just some good substitutes you can do even on a meal per meal basis. And anything you do is going in the right direction. So the goal is to make slow changes. And as you substitute out the garbage in the standard American diet and increase these, you'll often be very surprised at how well you feel, not just for inflammation, but other areas as well. So the particular focus of nutrients you're looking for then are the omega-3s. This helps to prevent cartilage damage and reduce inflammation. Best sources are fatty fish, flaxseed, chia seeds, and walnuts. Vitamin D, it's important, but unfortunately, getting enough from your food is hard. But low levels of D have been linked to increased joint pain. They've even linked low levels of D to bone pain. So by getting adequate vitamin D, you may find your joints and your bones feel better, just general supplementation, because of the lack of ability to get that through diet. And then vitamin C is really important for structure. It's all about helping to build healthy structure, healing your joints. Without vitamin C, a severe deficiency causes scurvy, where all your old scars open up. Your body's basically breaking down. So having adequate C to help form collagen, it acts like a natural antioxidant, so it's anti-inflammatory. And then some good dietary sources can be leafy greens, peppers, potatoes, and citrus fruits. So some additional anti-inflammatory tips. Dietarily, green tea is a great beverage, and it can significantly improve joint pain and arthritis. And actually, any of the teas are fine. White tea, green tea, there's a variety, even the black teas, but the green tea seems to have the best research behind it for that. Strawberries can significantly improve joint pain and reduce inflammatory markers. 1/8 teaspoon of ginger has performed well as well as ibuprofen for reducing joint pain and in the clinical trials. And then turmeric significantly reduces joint pain and similar effects of the NSAIDs with better safety. So using that as a spice is a good thing to do. So some potential considerations. This is just kind of a one-off. The nightshade family, although they're healthy for you, there are some people who are sensitive to a component in the nightshade family called solanine. And if you're sensitive to it, it's linked with more joint pain and inflammation. The nightshade family includes white potatoes, tomatoes, eggplant, the peppers, including bell, cayenne, and paprika, and then tobacco, even secondhand smoke, contains the solanine. So you have a substitution there on the right. Maybe instead of white potatoes, have sweet potatoes, turnips, or parsnips. Instead of regular tomatoes, have pumpkin, butternut squash, or beets. Instead of bell peppers, have celery, cucumber, radishes, carrots. Instead of chili and cayenne peppers, have black pepper, turmeric, cloves, ginger, garlic. And instead of eggplant, have portobello mushrooms, okra, and zucchini. So these are just some dietary substitutions that can make food fun to eat. So in regard to determining if you as an individual are sensitive to this family, because not everyone is, what you want to do is what's called an elimination diet. That means that you avoid this whole family, every single one of them, for a total of 2 weeks, 14 days. At the end of, you might mark down your level of inflammation before you start the diet, go for 14 days, and then mark down the level of inflammation after you've been off it for 14 days, maybe on a scale of 0 to 10, 0 being absent, 10 being severe. So you have a really objective way of assessing it. After the 14th day, then eat a ton of them for the next few days to a week. Just eat them like crazy. If you're not sensitive, nothing's going to happen to you. If you are sensitive, you may see a flare-up. And this may tell you, okay, I need to stay away from this or I'm going to be in pain. So if you can find an underlying cause, and that's really what natural medicine's all about, is what's the underlying root. And if you're just provoking it by eating, even though they're healthy, it's like for you drinking gasoline and throwing it on the fire. It's really obviously not a good choice. So it's nice to have an answer. May not be your best choice, but at least it can give you an answer. Another one is gluten. Gluten, whether you know it or not, is inflammatory for you individually, but it is. You don't necessarily have to have celiac disease. Most people that have gluten sensitivity are actually non-celiac, and that can cause inflammation, one of them being increased tendency to have inflamed joints. So you might try even doing something like a 30-day gluten avoidance. Just don't have it, and I mean completely. You got to be careful because it's easy to get contaminated foods in our current food supply. But maybe just try staying away from gluten for 30 days, just like you're avoiding if you do the nightshade avoidance. Think of it as a diagnostic, not as a life sentence, and see if that becomes part of your problem. So again, regarding the not people not knowing about gluten, about 80% of people, even though with celiac, they're silent. They don't have symptoms, so they're diagnosed. So, and people that are more gluten sensitive, the reaction usually occurs a time frame after they've eaten it, so they don't associate the consumption of the food along with it. So a 30-day avoidance would cover both of these sets of people. So weight management regarding osteoarthritis, again, obesity is a major risk factor for joint damage. The additional weight on the joint causes wear and tear that can eventually develop or worsen arthritis. And every pound lost reduces 4 pounds of pressure on your knees. If possible, try to keep your body weight within normal range. There's different ways of assessing that: your BMI, your body fat percentage, waist to hip ratio. There's a variety of different ways of assessing where you are and trying to get down there. So if weight loss is necessary, unfortunately, with a typical American diet, typical American people, it is. I think the number now is 70% of American adults are either overweight or obese. But if you lose weight, you want to do it slow and steady. Don't do crash diets. You want to make sure you're feeding your joints properly with your nutrients. And again, some people tend to exercise really heavily to try to lose weight, and that's bad for your joints as well. So in terms of perspective, even losing just 1 pound a year for 10 years can reduce your risk of osteoarthritis by 50%. And losing just 20 pounds of fat can reduce pain as well as the risk of the need for knee surgery. Focusing on adding nutrient-dense foods rather than restricting. For example, adding an additional fruit or vegetable to meals, especially instead of maybe a starch or a junk food. By adding in whole foods, you'll probably end up eating less calorie-dense foods without feeling restricted or deprived. So exercise is also really, really important for arthritis. The benefits: it reduces stiffness and pain and builds flexibility, strength, and endurance. If you have arthritis, you may know, or if you know someone who does, they get up and they start, like they've been sitting a while. It takes them a moment to get going, or you get up in the morning, it takes a minute to get going. And it's the functioning of the joint that improves its functioning over time. It's like loosening up the joint. Overall, certainly, feeling fit, etc., can improve your mood and self-esteem. Same thing with losing weight. It'll help you to sleep better and gives you more energy. It's interesting, but exercise improves sleep and gives you more energy. People think, oh, I'm going to exercise, I'm going to be all tired out. It actually gives you more energy and helps you sleep better. Again, it's very important for weight control. And it also helps to nourish your joints. When you exercise, there's more blood flow to your cartilage. It circulates more needed nutrients. And the weight-bearing exercise actually causes compression of your cartilage cells. You want to think of your cartilage cell like a little water balloon with an open hole. And when you compress it, like you do when you compress your joint, you're squishing out the internal fluid. And as you release that, it goes back in again. So it's a continual in and out of these fluids into the cartilage cells. Cartilage don't have blood vessels to circulate, like your heart circulates blood in your blood vessels. Cartilage doesn't have a pump like that. It's the action of compression and release that helps to nourish and keep your cartilage healthy. So some tips about exercise and stretching: be sure to warm up before stretching. This can help reduce risk of injury. You want to start with low impact exercises, and depending on the amount of stress on your joints already, this can reduce strain on your joints. So walking is good for everybody. Bicycling, swimming, if you're in particular pain, non-weight bearing like swimming or recumbent bike would be important. And then it's also important to consider strength training. You want to use range of motion exercises. This puts joints through their full range of motion so that they can remain healthy. So for instance, rolling your shoulders forward and back is just one example of a range of motion exercise. It's kind of typical, especially as you're beginning exercise, to have some soreness afterwards, but it really shouldn't linger. You might even want to go a little slower, even less than you think you should at the very beginning, and just slowly increase. But if you have pain longer than 48 hours afterwards, it means you've really overdone it. So you need to back off. It's better to start low and slow and then slowly increase rather than having to back off like that. So again, it's easier, it's better. If you overdo it, you certainly want to go easier the next session, but it's better not to get there in the first place. So if you have joint pain, discuss exercise with your healthcare provider and make sure you're doing something, or work with a trainer who's trained in that particular area. So some lifestyle changes again: stay in motion. The more you move, the less likely stiffness will set in. Take frequent breaks from sitting. Again, some people will feel stiffness when they get back up again. So try not to sit without motion too long. Avoid repetitive motions. We talked before about that when we're looking at the structure. Repetitive motion injuries are common. The important word here is called ergonomics. You can work with your employer or wherever you are to find things that, if you're feeling symptoms from doing too much, that it can be done better. You're at a keyboard, they have ergonomic keyboards, they have armrests that can hold your wrists up so you don't get that going on in your wrists. If you're lifting, there are back supports to help you lift in a healthy way. Learn how to lift, in a healthy way, like with your legs instead of trying to lift with your back. So you really need to be careful. You can induce things if you're not going to be careful. So use padding when you're doing activities like bicycling or skating to prevent injuries. Just padded seat, things like that. It's really important to control your blood sugar. That's kind of what the Mediterranean diet is all about. It's giving you more nutrients and less of the readily available carbs, like this typical American diet. So diabetes, blood sugar dysregulation can be a significant risk factor. High glucose can make joints stiff, trigger inflammation, accelerate cartilage loss. So the diabetes it can also reduce blood flow to the joints, things like that. So getting your blood sugar under control is really, really important. And also, getting overtired. Fatigue can increase pain. Make sure you're getting enough sleep for repair. That's when we rest and recover, and repair is at night when we're sleeping. So you want to make sure you're giving yourself adequate time to sleep, and try not to get overtired. And then not smoking. Mayo Clinic study showed smokers have more severe pain and we're more than twice as likely to have significant cartilage loss. And a kind of a double whammy, if you're sensitive to the nightshade family, that tobacco is in that family as well. So that can be inducing more inflammation. Okay, so what about the medications that they typically use for arthritis? Some of these are available over the counter, while others need prescriptions. They can be pills, creams, lotions, or injections. Here are some and how they work. The analgesics. Analgesic means pain reliever, so these relieve pain, but they do not relieve inflammation, and arthritis is an inflammatory condition. Typical options for analgesics are acetaminophen, Tylenol, but you have to be careful about the dosage limits. You can damage your liver if you take it too much, and especially for too long a period of time. Prescription components, things like opioids, tramadol, hydrocodone, oxycodone, they're strong controlled substances. They can be very addictive and should be avoided if it's at all possible. The more common ones that are used typically for arthritis are called the non-steroidal anti-inflammatory drugs, NSAIDs, and those are available both over the counter and on prescription. So these are the most popular drugs used for arthritis because of both the pain relief and the inflammation relief. They are non-narcotic and non-addictive, and some items are aspirin, ibuprofen, naproxen, and there's others. Unfortunately, these may cause stomach bleeding, ulcers, and increased risk of heart disease or stroke. So even though they're over the counter, these can be very dangerous. The NSAIDs actually cause damage to the cartilage and inhibit the growth of new cartilage. Now, kind of NSAIDs can be a double whammy. They're taking away the pain and your perception of pain and inflammation from an already damaged joint. So you end up overusing and causing more damage. But in addition, these NSAIDs actually inhibit the way you grow new cartilage. So they're inhibiting repair as well as masking symptoms. And technically, you're speeding your way towards a joint replacement. Again, like with the Tylenol, there are strict maximum daily limits for the NSAIDs, again, even though they're available over the counter, and you want to make sure you follow those. Another class is called counter irritants. These are creams or ointments, roll-ons, lotions that have ingredients such as menthol, which gives a cool feeling, or capsaicin or methyl salicylate, which give a hot feeling, and rubbing these on your joints may stop pain signals. When they say counter irritant, what they mean is it's kind of like when you get bitten by a mosquito and your arm itches and you take your fingernails and you scratch that area. You're confusing the nerves in the pathway and distracting it from perceiving that. So when you put these things on, like menthol, it's helping to confuse your nervous system. So it helps to keep you from realizing that there's pain there. Now, in addition to those, there are some natural supplements. My favorite, and the one that is extremely well researched and shown to be beneficial, is glucosamine sulfate and chondroitin sulfate. And it should be the word sulfate after each of these words. There are other glucosamines, hydrochloride, NaC, etc. The only ones that are clinically studied are glucosamine sulfate. The important thing is that the sulfate contains the atom sulfur, which is important in cartilage growth. So it's like part of the ingredients in glucosamine actually feeds nutrients to the cartilage. So glucosamine is critical in the formation of joints, cartilage, tendons, and ligaments. It's actually naturally found in our body. And then chondroitin reduces inflammation by increasing cartilage synthesis and helping prevent cartilage breakdown. So the glucosamine helps with the increasing the amount of cartilage you have, and the chondroitin helps with making your cartilage cells more resilient. So it really is a significant product to use. In a 2016 multinational study called the MOVES trial, it was found that glucosamine and chondroitin are as effective at relieving knee arthritis pain and swelling as celecoxib, which is also called Celebrex, without side effects. So here you have a prescription NSAID, celecoxib, that in the long run was found to be better at relieving pain and inflammation the glucosamine chondroitin was found to be better than the celecoxib in the long run. And again, I already mentioned all the side effects of the NSAIDs. So it really is a pretty dramatic thing. But again, it's in the long run. When you take glucosamine, it's like fertilizing a plant. It doesn't happen immediately, but over time, the cartilage will grow. Generally, give it 30, 60 days, and you would hopefully begin to see the beginnings of relief. And then over time, you reduce that. Recommendation would be for glucosamine chondroitin to take 4 capsules per day with food. By the way, I have these supplements in your slides. There are links to a brand, these products called a company called Designs for Health. They are a really, really top grade company that makes nutraceuticals. One I highly recommend. One of the problems with natural medicine is the lack of government oversight of whether these products are actually effective or whether they even contain what the label comments or declares that's in there. So one of the kind of the real issues is, okay, gee, I want to help my arthritis. I'm going to take glucosamine chondroitin. You use a product that you don't know anything about and nothing happens. Well, now you end up on ibuprofen. But if you use a good quality product like Designs for Health, you might not have had to do that. So that's just my recommendations. If you're going to use something, you really want to be the top shelf, so to speak. And the Designs for Health is one of those top shelf companies. So again, with this product, it will be 4 capsules a day, generally right along with food. Next product is collagen. This is what your body uses to make skin, tendons, bones, and ligaments, and taking it as a supplement can help to augment that. So again, from Designs for Health, it's called Whole Body Collagen. It's a powder. You take a scoop a day in some kind of fluid, and generally it's best to have it along with a meal as well. Curcumin is an anti-inflammatory, pain-relieving herb. It's an ingredient derived from turmeric that can help with the symptoms of arthritis. Again, from Designs for Health, C3 curcumin complex. Dosing is variable based on you as an individual. Kind of an upper dose to start with if you're in severe pain might be 2 capsules 3 times a day. If you're more moderate, you might do 1 capsule 3 times a day. If you're kind of low, you might do 1 capsule 2 times a day. So it's really variable, but over time as these work, you can even begin to taper backwards, maybe once a week if you got good control, once a week reduced by 1 capsule, and see what level you might need to maintain. It takes more to get inflammation and pain under control than to keep it under control, and you might not need that much. In fact, even the glucosamine, over time, if you get to the point, gee, I have no symptoms, then maybe drop down to 3 a day, and maybe once a month with that product, drop down by 1, and see if you can get along with less. We talked about the omega-3s earlier. A lot of people don't get enough omega-3s in your diet, so supplementing is a good way to do that. Again, studies show that an increase in omega-3s can help reduce inflammation. It also helps with your heart health, your brain health, reducing cholesterol, reducing triglycerides. I mean, there's lots and lots and lots of benefits of omega-3s. So a good one, again, from Designs for Health is called Omega Vale Hypo. You would take 2 capsules a day, generally with food. It could be 1 twice a day, 2 at one time. It doesn't really matter. And then if you want more immediate relief, this product called Arthro-Soothe Cream, again, by Designs for Health, has a variety of ingredients that helps to relieve pain kind of immediately. So just massage in as you need to. You can use it or not use it, depending on where you are. If you used it and you're fine and then it starts to come back a little later, you can apply it again. It's fine to use all these supplements together at the same time. So it really, the Arthro-Soothe, one way of using it, say you tend to have a joint that's affected, like say you're going to do some knitting or you're going to play tennis and your hands hurt, well then apply it ahead of time and you may find you do a lot better with that. So in conclusion, our joint health is critical for our ability to move, exercise, work, and play. It should be a priority to maintain healthy joints in order to remain independent, strong, and vital. Lifestyle factors like maintaining a healthy weight, exercising, eating a healthy diet to reduce inflammation, regulate blood sugar, getting adequate sleep, and using natural supplements when needed can go a long way towards keeping your joints healthy and symptom-free. And by the way, that can go a long way towards keeping your body symptom-free. So all these different lifestyle factors have many, many, many more benefits than just your joints. So it's a good idea to adopt a healthy lifestyle, which involves your mind, your body, taking care of yourself, again, adequate sleep, plenty of fluids. By the way, you need plenty of fluids because cartilage gets dried out when you don't have enough body fluid. So a sign of dehydration can be joint pain as well. So overall, it's good to take care of yourself.